Hello everyone, my name is Colin Graham. I'm currently an EMT for J&Care and Romney Rescue. I'm currently participating in Pierpont's Friday Paramedic Program. Today I'm going to walk you through the steps of a primary survey from the standards of the National Registry of Paramedics and EMTs. As we're walking through the door, we are forming our general impression of our patients. We are looking for their facial reactions, their eye contact towards us, how they are dressed, are they well groomed, how they are speaking, did they acknowledge us at all. We will be smelling for odors, possibly body odor, or environmental odors. We're also looking at how many words per sentence these patients are talking to us between breaths. Do we hear any abnormal sounds? Are they in the tripod positions? We're looking for retractions, and lastly, we'll be looking for nasal flaring. Next, we will establish our patient's awareness level, or we're going to be using AVPU. Does our patient acknowledge us without having us say anything? Or does our patient only acknowledge us if we do a sternum rub per se? Or are they unresponsive to everything, including a sternum rub and speech? We will also do a quick evaluation of life threats. Life threats to our patient include major hemorrhaging or an airway obstruction. After we address any life threats to our patient, we will then check their ABCs, or their airway, breathing, and circulation. We're going to ensure our patient's airway is open and patent. We will open the airway with either a head tilt chin lift or a jaw thrust. If it is trauma, we'll be using the jaw thrust for our patient. We'll be looking to make sure we see normal rise and fall of the chest equally and bilaterally. We will look at our patient's respiratory rate, rhythm, and quality. We will initiate any oxygen therapy at this time as needed for our patient. Do they need a nasal cannula or do they need a non-rebreather? After we make sure our patient has a proper airway and is breathing well, we will check their circulation. We will check both radial pulses on the inside of the wrist with our two fingers. Make sure you do not use your thumb. We are making sure they are the same rate, rhythm, and quality on each side. If there is any devotion from either side, please make note of that and let the ER know. We will then assess our patient's skin turgor, the elasticity of the skin or signs of dehydration. And we will put our back of our wrist to the patient's forehead to check skin temperature, texture, and appearance. Are they pink, warm, and dry? We will also control any severe hemorrhaging that we missed previously. Once we have our ABCs down, it is time to add a D and an E. D is for disability. We are going to use a pen light to check the reactiveness of the pupils. Then it's to E. E is for exposed. This means we're going to remove any necessary clothing on our patient to be able to apply any appropriate equipment such as a 12 lead or to look for any other injuries. For your last step of the primary survey, you're going to decide if this patient is critical and do they require immediate transport, or is this patient stable and you can spend more time on scene. Thank you for participating and learning the proper primary survey, and have a great day.